try to stay away from doing things live.
So we can repeat that.
Just so that
Yes,
we can repeat.
If I say a bad word.
Oh, absolutely.
We'll bleep it.
You'll leave it.
Yeah, we have a censor button right here ready just for that.
So we can start with a little warm up, maybe.
Yes.
Recording.
Yeah, okay.
But we can
And then
warm
we can-
up.
Warm up or not, we can just get started, just kind of feel the room, see how we're feeling, and then if the conversation kicks up from there, that'll be part of it. So I guess from here on, I'll go ahead and hit record just so we can start. Check, mic check 1.
Mic check 2.
What's up, everyone, and welcome back to another episode of Health Yes, here at Cameron County Public Health, where we talk about all things public health and more. I'll be your host today, Javier, and joining me at the table is my colleague,
Andrea Gomez.
Today, our guest is Pediatric Cardiologist Dr. Amer Salhadar. Joining us today to talk about some healthy heart tips for American Heart Month. Welcome to the show.
We have a really interesting episode lined up today. And aside from February being American Heart Month, I think where we should focus is really on children's heart health. And that's exactly what we're doing today.
Valentine's Day is the staple of February. And what better way to talk about the heart than to talk about healthy heart tips that we can, keep in mind.
I think it's very important to talk about healthy hearts in kids. We tend to focus more on the adult and all the problems that happen after a certain age, but we tend to skim over the fact that heart disease can be present before they're born, when they're born, and as they're growing up. So I think this is the perfect time to talk about this, not only because it is February, but because we have the awesome opportunity of Dr. Amer coming down.
Exactly. I mean, usually, the older we get, the more stubborn we get about making sure that we're okay.
Yes.
So what a better time to target and educate people than at the early stages of adolescence and being kids.
And also the perfect opportunity to shed some light for parents on their children's heart health.
Absolutely. Welcome to the show, Doctor.
Thank you.
Can you start off by introducing yourself a little bit, who you are, what are your practices, and what are you here to share with us?
My name is Amer Salhadar. I am practicing pediatric cardiology, and I see patients since they're born until mainly 18 years of age, or sometimes more than that. I've been here in the Valley, serving the Valley for 27 years.
Wow. So doctor, why do we feel it's important to talk about heart health in general?
The heart health starts since birth. The kids can develop congenital heart defects, can acquire heart problems since they're young. So it's connected to the adult lifetime. And so it starts at the beginning. And we like to diagnose them earlier, prevent them from having more problems when they get older, when they become to the adulthood.
What would you say are some common signs or symptoms that show up?
The common signs of symptoms are really related to age-related. We can divide the symptoms into certain age, starting the newborn period after birth until 1 month of age. And then it continues with the infancy, which is the first year of life. And then we start after that with preschool, toddlers, and then we go to school year and adolescent. So every age group has different symptoms and signs. It has to be recognized. So the infancy and in the newborn period, the signs depends on the pediatrician examination and the parents' observation. It's very important to monitor these signs, and they are different. They can vary from not eating well, not growing, breathing difficulties, breathing hard, fast, not growing again, or changing colors, their skin, their lips. So there are really signs that it needs to be taken care of. And that mainly the task of the parents or the families around them, the grandparents usually. The preschool kids are more difficult because they don't explain what they have, they feel. They don't tell you that they have a chest pain and they get dizzy. So they have to be monitored. And
Closely,
they
right.
should closely by the parents mainly, and they have to be referred to the pediatrician when there's any concern. This is the most difficult part of the diagnosing those kids. They might have rare things in the heart, and sometimes they cannot explain what they have, and they can be ignored, such as fainting, chest pain, or feeling that the heart is really racing, irregular.
Because even sometimes it can be difficult for a child to even know what's happening with them. So
Exactly. Even an older child,
right.
you'll be surprised. They might
Maybe they're
not
scared,
able to explain
they're
what
Right,
embarrassed
because
as well,
symptoms.
too.
they might not
Right.
be familiar with
Yes.
the name of the symptoms as
exactly.
we know them as adults. So what you're saying, doctor, is that it really falls under the role of the parent to be constantly aware.
And also the pediatricians and the pediatric cardiologists have a role
Right.
on educating those kids.
Right.
When they come to the office, they have to tell them what to look for. It's very important for the kids to be educated, to be alarmed at what they might have and might they feel. And so this is the education is very important at this age group.
Because it'd be a lot easier to understand what the diagnosis is when the child can verbally tell you exactly what it is you're feeling.
It is really sometimes very difficult, and that's what the main reason for referral to pediatric cardiology is, because many of them, they're normal. They don't have any
Right.
issue, but
Yeah.
you never know. It's
Right.
really very, it's a combined effort
Right.
from everybody, starting from the home until they reach the cardiology
Right.
evaluation.
Have you ever had any experience with someone, I guess, who doesn't know the signs and symptoms, and they just kind of come to you and they're like, what do I do? Can you explain to us like a situation like that where
This is a major part of the visit to the office, is to really explain to them everything, and I would say that they really appreciate that. And then the main issue is to have monitoring them.
Right.
Even if they leave the office, everything is normal. They can be educated to follow up, the kids and the parents too.
I'm kind of curious. I'm not a mom, but if I were to be referred to a cardiologist and I would have to take, let's say, my 3 or 4 year old kid, what would a visit to the pediatric cardiologist would look like? Could you walk us through that?
Very briefly, they come to the office, and as usual, at anything, the first thing is we take the history. This is very important. From the patient, if they're older, and from the parents, very important. And we take the main issue. What's the problem? What's the history? How long is been having these symptoms there? Even if the babies, they need to tell us everything. And it's going to take time, but it's very important. And then we take the family history. You'll be surprised. Family history in our subspecialty is very important. Anyone in the family who's sick when they're younger, we have any heart problem, this is very crucial. And then we do the vitals, we look at the temperature, the heart rate, and then we do now a simple test. We do an electrocardiogram, which is monitoring for the heart electrical system, and it's something like very simple these days now. And then we ask them a question again about their activities, what they feel, and if they anything related to exercise. So it is a little bit different than adult approach that. And then after that, we examine the heart, and we take blood pressure, and we do better to do it by the cardiologist himself. Examine everything, even the blood pressure, even when you listen to the heart, and check everything. All the arteries in the body has to be checked. after all this, you do the diagnostic work. Like if we need to do an ultrasound for the heart, which is the same thing, ultrasound, we can see the heart and we check the function, the structure of the heart. And then we do more than that if we need. We can do like adults stress tests, we let them run and see how they do. And then we can do we give them a monitor to monitor their heart rate, which is perfect. And we have state-of-the-art now equipments to record the heart rate and even send the recording by satellite to be evaluated. So this is basically what we do.
Wow.
This is before the treatment. So
Right. That's just the check-in.
That's the check-in to find out what's going on.
Interesting.
So.
And doctor, with all these examinations, I'm sure many things might show up if there's something wrong. Could you explain one of the complications or diseases that might show up in the child?
It's very easy. When you do everything in front of the parents, in front of the kids, without a third party, that's the package of success, because they see everything. You explain everything right away.
Right.
We don't tell them like, okay, I'll give you the results next
Much
2 weeks
mailed
later.
in your home.
This is the kids.
Yes.
And we
Right.
worried about our kids.
Of course.
We worried more than anything else.
Of
So they
course.
need to know right away. And when you show them the heart and we explain everything to them, they will feel much comfortable.
Of
and
course.
they will understand. This is not like something magic. If someone showed them the heart and everything, it will be easier to complete the exam by explaining everything. So explanation is the major part of our standard of care of pediatric heart patient or suspected heart problem.
Right. I can imagine that, you bring in a parent and a child and, they already come in kind of freaking out as to what's going on, having this peace of mind of like knowing right then and there.
That's correct.
That they have that and that they know what's going on, what isn't or what is a huge load off of parents.
They need to know right away.
They do.
They
do.
If anything, it could cause even more complications later if there's a wait.
Would you say that there are some complications that might not be as complicated as others or less severe than others?
It depends on complaints, what they feel, how they feel. That's what I'm telling you. The history, taking the history and asking questions is the most important thing.
Right.
And that can be done by the nurse, by the medical examiner, and has to be completed by the doctor. The doctor with experience and everything, he can really filter those who are really having could have a serious problem. So and then you can still work on that. It depends on your level of severity of the case, and then you can build on it. And it's very important, trust me, to really listen to them. Right. And then the next action depends on the history, and so you can tell from what they tell. I have a little pain here, a little palpitation. I'm nervous. You know that it's not really significant. You cannot do a full exam for someone who really suspect that. But it's really a very difficult thing, especially with the tiny babies, and then the toddlers.
Right.
We've been talking about like how easier these processes have gotten. What are some examples of like how difficult it had been before as compared to now? Like figuring out these diseases and complications.
Yeah, it is really everything started like I can tell you 40 years ago with the development of the ultrasound and everything. It was very difficult to recognize these heart defects, especially congenital heart defects. It's really we're very lucky. We're like in this age where we can see the heart. We can see even the three dimensions, and then
amazing.
We can monitor the heart rate, the function, in a very efficient way, and we can do a lot of procedures without surgery.
Even the tools have gotten sophisticated.
Even we go from the legs, from the arm, and then we can repair a lot of things without opening the heart these days.
Because I remember that a lot of these surgeries have to be very intrusive.
We're
complicated.
Like 50% of these surgeries are done now by the cardiac, from the vein, from the leg, without with just a camera and monitoring with the catheters, we call them. So it is a major
We've
development.
gotten
Right.
so far
in
from
that.
back then.
Oh,
Yeah.
yeah.
And
Way less invasive, more convenient for the patient also, and maybe also less scary because when we usually talk about heart surgery, we tend to think like open heart surgery
Yes.
or
Yeah.
very complicated procedure.
Yeah, immediately the red lights turn on. Oh,
Yes.
heart surgery.
Yes.
Oh my goodness, what's going to happen?
Again, the explanation to the parents is very important.
crucial.
Otherwise
Oh.
they will freak out.
Gary,
You want them
Absolutely.
leaving your
Yeah.
office
Yes.
with
Yeah.
dotted I's and crossed T's.
Even unfortunately, even if the little child has a significant heart problem was found out for the first time, they will at least they get emotionally sad, very
course.
sad, but
Yes.
at least
Of
they
course.
will understand what's going on, and then you give them solution. So it is really very promising. For kids, it's so promising. For the parents too, it's rewarding because most of these defects can be really dealt with, and patients would be back to normal life.
So it's all about going at the right time.
Yes.
In early stages.
Yeah.
Detecting it early.
Yeah, early stages, and even there's something a little bit frustrating is like when child is born with congenital heart defects.
Right.
These are frustrating. The early recognition is now we really screen them before they're born. So we do a fetal ultrasound also for the heart. So every day in my office there's a few patients coming at the end, ladies, pregnant ladies. So we screen their heart with their suspect heart. So we will let them know in advance before the baby is born. It is a little bit depressing for the mother, but at least they know what they do, and then
They
we
prepare-
act on
it
it.
lets them
Yeah,
They're
prepare.
prepared. And we act on it. We take the baby
Exactly.
and send him for surgery, or we do monitor the babies on that.
And I
So
guess it won't come as such a surprise. I mean, even
Exactly.
feeling overwhelmed with
Yeah.
being, let's say, a new mother or just adding another child into the home, and then surprise, there's this disease, underlying disease that we have to deal with now.
And now in the valley here, we usually even most of the cases we send them for surgery to Children's Hospital. We let the surgeons and the team there see them before even their babies are born, and they talk to them. They tell them about the surgery and the care. So this is really getting better, and the serving the kids in the valley with congenital heart disease or heart problems in general is really getting better. It's a joint effort from everybody, even if we have to send them to a tertiary care center like a children's hospital.
Oh, we
they
can
will
only
be
imagine.
the communication with all these is really getting better.
I'm so glad to hear that. And doctor, is there a predominant disease down here in the valley that you might see in kids?
Yeah, it is. It is notorious in the valley here, in the Rio Grande Valley. Since I've been here, and many pediatricians know that, and doctors, we have a higher number of congenital heart malformations. They are born with heart defects, and there's too many factors. It could be genetic. This is a genetic pool here in the valley, and it could be. They
We
say,
have bad hearts.
yeah, they say it's environmental.
Yeah.
It's really not quite settled what it is, but it is higher.
Down
And
here.
it is higher down here, and it's higher and I can tell you, in Hispanic community, I used to work in Chicago for 11 years before I came here. And also, I used to go to cities around Chicago. They're predominantly Hispanic population.
And would you see the same
And
problem?
they have a higher
So-
rate of congenital heart disease.
Wow.
So the main issue is the congenital heart defects, and that's what is really notorious. Other than that, it's the average population. You can see an adolescent and kids, they can have some rare bad heart problems, but it's the average of nationwide.
Right.
Yeah, so that's
But in
that's
Hispanics, you can really point out
It's,
that congenital heart
it
disease is the
quite
problem.
Clear. It's quite clear that.
And what about heart murmurs?
It's a myth. There's nothing called a heart murmur.
I've heard that so many times in high
soplo
school.
in Spanish.
Yeah.
And the murmur is, they say in literature, English literature, is like they say a murmur in the tree, like a murmur in the
Yeah.
tree, like a noise.
Like a whisper.
Whisper.
Yeah.
And that's what they say. So murmur, there's nothing called a murmur. Just like my car has an extra noise. Murmur is a noise in the heart, extra noise. When we listen to the heart, we hear only the noise of the valves inside the heart. We have 4 valves. They hear when they open and close. So we hear something like purupu, purupu,
Right.
purupu. Any extra noise, we call it a murmur. It could be anything, just like a noise in your car. So there's no diagnosis of murmur. It's not a hole in the heart or anything. And there's another noise, could be a click. So there's different noises we hear with the stethoscope. The stethoscope is the doctors, what they use here to hear the heart and the lungs.
Yes.
So you cannot say, I have a noise in my car. What noise? I have a murmur. Murmur is not a hole. A murmur, it's either something normal. Many of us have an innocent murmur. It's a noise, very soft noise from the flow of the blood, extra noise. And if the murmur is abnormal, it could be anything, just like a noise in your car. You open the hood and hear the noise where it's coming from. Could be any defect in the heart.
That doesn't automatically
Maybe
make it a
something-
murmur.
It's a murmur.
Yeah.
Yeah.
Yes, I've heard so many times people say, "Oh, I have a heart murmur."
Because it's a bad education
Yes.
from the previous generations,
Right.
unfortunately.
Oh, yeah, and
And it's
they
something
hang
that
on
sticks,
to that. Yeah, 'cause
too.
They hang on to it, and they think,
Yeah, it's wrong.
they think, oh, whatever is wrong with me right now, it's because of my heart murmur.
Yeah, because they should say, I have a heart murmur because I have a narrow valve. I have a heart murmur because I have a hole in the heart. Just a noise. So, there you go.
So like how you were saying earlier, education is a very vital thing because a lot of people will hear something like that that can be described as a myth or just something that they heard on the street or something and think that's a problem, like a huge problem.
It's the main reason for that is the doctors and the nurses have to explain everything
Right.
to these people. They have to have time to explain that.
And also, I guess, misspell any information that they might come with. You know, they might go to your office with a certain knowledge, and you might be the one to set the record straight in what they know, whether it's fact or myth.
Because a lot of times, especially from what I've heard at least, they hear the term heart murmur and they leave it at that. They don't describe what exactly is causing it or what have you.
There's another issue. It's really important now. The social media.
Yes.
You know, they can Google
Yes.
everything, every
Yes.
disease. And I just want people to know that exaggeration of these things is not to their liking because they hear that there's a fast heart rate. I mean, someone has something bad happen to him. They need the criteria. They cannot have a monitor like a watch monitor or a monitor to check the heart rate
Yes.
and the oxygen saturation. They have to really have a criteria, guidelines. You cannot come to the doctor's office, tell him, oh, my child's heart rate is 120 beats per minute. You need to have a guideline. So we give them these guidelines because the internet and the social media, everybody is available. Everything is available now. They read about abnormal heartbeats. They read about chest pain. So they need, again, we come to a point that this is the major reason for confusion and anxiety for the parents. It's like they seek all these new things, technology, and then they do sometimes an EKG, electrocardiogram, somewhere else, and it shows abnormal. Abnormal is the report sent by the machine, and the doctors have to evaluate it. So they should not worry too much.
It really should be
until they get the professional person to read it and explain everything.
Selective
Absolutely.
physicians only.
Sometimes technology
It can be both harmful and helpful.
Helpful, of course, they can be helpful. I have an advice for the parents in general.
Let's hear it.
Not to really panic too much and not to get nervous and not until they get to be seen, the kids, and get the diagnosis. And so we do have the means to reassure them, and as long as the child looks normal, good, is not in despair, and the clinical condition is very important. If there's no significant symptoms like severe chest pain, fainting too much, or really that the heart beats very fast, extremely fast for more than 10 minutes, 15, 20, these are the bad signs. If the child fainted while running, more than one time, or exercising, these are the things that you should worry about. And usually the pediatricians send them to my office quickly But other symptoms, the heart murmur, they have to wait. Could be nothing, could be normal. So I advise the parents not to really
Be so
very nervous,
apprehensive, maybe.
unless there is a major issue, like someone who has been sick, a toddler, a child, a baby who's been sick. The babies, when they don't eat, they don't grow. When they have fever for 10 days, when they get sick, after the fever, they can't walk. They're very tired. They're short of breath. These things, we call them acute things, like something really urgent, the changing in the child condition quickly, suddenly, severely. These are the things that they should worry about, and they should really take advice from the pediatricians first. The conversation today is mainly for educating the parents.
Yes, of course, absolutely.
Okay. Because this is pediatric cardiology, not adult cardiology.
Exactly.
Right. This is for the parents knowing maybe what the steps are to take, and now we know. First of all is keep an eye, be aware, and explain everything to the physician. And then step 2 would be up to the physician, which we know that are great. They would refer them to you. You would be the last step, and depending on the findings, that would be step 4. Now, thinking about how a child could grow and develop, what should you expect from a preschooler, maybe a school-age child, or a teenager? What are the precautions and recommendations?
The recommendation for the parents, number 1, to monitor the health status, as I said before. Detect sudden change, I repeat that, sudden change in the patient's, the kids' activity, and how they breathe, and how if they complain too frequently about certain issue, they need to be aware of that, and they should refer these kids not to me right away, to the pediatric clinic. We call it red flag, especially if it's really frequent fainting, if it symptoms with severe exercise, severe chest pain, or having a lot of palpitation. Palpitation is a fast heart rate that very fast and lasts for a lot of time. These are red flags for us. These has to be addressed to the pediatrician. And the teenagers and adolescents are different. We have to really give them guidelines for well-being, health-wise, lifestyle, exercise, diet is very important. Obesity is amazing in this area, and that can really affect them. We tell them that they can affect them. So when you examine them, show them the heart, it's very good to tell them that they don't have to be upset about what I say. They have to. I teach them that the future lifestyle is very important. Diet, exercise, drug-free, drugs, and it's good that most of the kids, actually the adolescents, admit that they take in drugs, by the way, and that helps me guiding them and show them, not to scare them. It in a way to scare them, because I show them, look, this is the heart.
Happen.
If you do something, that's what happened. The coronary arteries get spasm, and people can die from drugs. So it is an ongoing education while we examine them. And then it's very clear. This is a very hot area here. The adolescent and the kids who are really trying to be heroes in football, soccer, they can face major issues such as heat stroke, dehydration. They can have sudden onset of something called rhabdomyoma. It's a magic word, but it's like when they exercise vigorously, they can the lack of oxygen to the muscles, including the heart, decreases, and these kids can really collapse, and so they can end up in the hospital very sick, especially if it's really high temperature, and they can get very sick. So I educate those kids who are trying to going to the major league, to NFL, is to really be careful.
So then
they have to take it easy, slow down. They have to rest.
Right.
This is very dangerous. Every year, especially at the beginning of the school, we admit kids to intensive care unit.
I bet all the athletes, the child athletes.
Yes, athletes are crazy guys sometimes. They have to.
They want to
really
be the
careful.
best, I guess, and
But
in that they're-
everything is in moderation.
Yeah, and
Yes.
coaches will sometimes push them a little too
Yeah,
much, and
and
they
unfortunately.
see
I
that as the
bet.
expectation.
So then, doctor, what we're seeing here is that maybe with teenagers, we're hitting different types of snags. We have the two opposites. Kids that might not take care of themselves, they're already in the know. They're a little bit more knowledgeable about saying whenever you feel a certain sign or symptom. But then we have teens also consuming drugs, or we have on the extreme where kids want to be athletes and they're pushing their body. They're both pushing.
But both are
they're
wrong.
both pushing
They're
their
both
body
wrong.
to the limit.
Yes. Yeah.
And so I'm assuming that entails like a whole different onset of problems in whether you get back on the better track faster than maybe a child if you detect it at 3 or 4, where you certainly are not going to have that type of problem.
Yeah, it is very important to also to admit them sometimes if they're on drugs, because you will be surprised. They can have a lot of problems with drugs. We can have they start to have heart failure, which is a weak heart muscle. They can have a rhythm problem. They can have something that affecting the heartbeats, and all these can be really serious things. And it is really very important to take care of those kids. And and I am so glad that the parents are open with me. Sometimes they don't tell anything to the medical examiner when in my office. But when they come to me, they tell me that they have drugs
I guess
and everything.
it's a touchy subject.
It is very important.
And I guess that as a
but
parent,
they have to tell that to someone.
Of course.
So,
who better than the cardiologist?
Yeah.
But I guess it's sometimes hard to even admit to yourself, let alone the cardiologist, that that type of problem is going on. But it's the best.
I emphasize on obesity. Obesity is very important. I mean, that leads to a fat. That's what they say in pediatric. A fat child is a future heart problem, a future heart attack.
Yes.
That's what they say. And then it's not only heart attack, of course, diabetes and everything.
Many. But again, it's pushing the body to the limit where it should not be in the first place, whether that be intense exercise, drugs, or eating too much. So, doctor, what are a few examples of heart complications that we can see, whether in any age group, that can be developed?
The first thing is with newborn babies, congenital heart defects. And that is so complex. Sometimes it's minor heart defects can be dealt with easily. And then the same thing, congenital heart defects is like the heart have malformation in the heart, major malformations or minor, and that can be detected right before the child is born, after birth, or really late detection. Sometimes these defects, like big holes in the upper chamber, can be late detected in 1 or 2, 3 years from now. And then the second thing is, like, give you an example of older kids. One of the main things that we worry about is something called myocarditis. It's an inflammation of the heart muscle, and usually occurs with the virus or sometimes bacteria. But any little cold symptoms, any virus can really create an inflammation of the heart muscle. And most of them, thank God, most of them they recover to a normal pumping. I mean, the heart get failed, but sometimes they don't recover, and they has to be monitored. The parents will notice that the kid cannot even walk, very tired, and so after a little cold in few days earlier or few weeks earlier, sometimes COVID used to do that, but many viruses can do that. So this is very, very important and not scary. You just have, when the kids have that, they usually have symptoms. So people should not worry too much about it. They will be very sick and very tired. They cannot even run, and that's something people have to be aware of, especially after like cold symptoms or something. And then there's another thing, very common. I mean, rare diseases that when the kids faint, all of a sudden they have severe chest pain. They can be born with something very dangerous, and this will be picked up by screening the heart. And they come and they will screen everything. So the screening of the heart is very crucial. All these means of detecting the heart issues very important, and then it has to be done right. Yes. It has to be. And then the last thing is, some kids are born with not like adults, but they come born with irregular heartbeats. They come and they say, oh, major heart, like the heart is really fast or very slow, they faint. So the electrical system of the heart also is something very important to detect. And again, can be detected by technology, by monitoring, and there's too many things.
Yes, of course, of course. I have an extra question. Now, I know we said that we should stay away from what we read in the internet, but then also some might be helpful. Based on your knowledge, are there any resources out there that you would say, you know what, whatever you read on that website, it might be factual?
You cannot Google everything. You can just go to big centers, children hospital centers in Cincinnati, in Boston, here. They all have websites, and they're very, very smart. They tell the parents exactly what they need to know. Because if you go and open something else, you get scared. The parents will be very confused.
Yes.
And they will come and they get very nervous, very paranoid about everything. So I do ask them to have these only well-known websites that give you a little idea, all you need to know. Clearly, but with no details. Details sometimes makes you so nervous.
Oh, yes.
So then I guess it would be more of a use what you see online as just as a warning signs thing to see maybe what to look out for, but not as a conclusive.
Exactly. And then the last word should be with the pediatric cardiologist.
Yes,
and
absolutely.
The pediatric cardiologists and the pediatricians they have to guide them to how to, because this is something different than like before. It's a technology age. And
now it would be normal nowadays to do a little bit of research
it is very big, and I tell them
to have a basis.
We tell them
research.
to go and research that, and in the past we used to give them pamphlets about certain diseases. I mean, it's like we're talking about 20 years ago. We don't do that anymore.
Yeah, it's very much of the the information is out there, but it is very much if you do want a conclusive, like I have this, or I want to know if I have something, it is very much you have to go and talk to the expert.
But again, the expert is the leader.
Yes.
That's a number one source.
Like the coach. He's not going to show you what to do, what to look for.
Of course. Do you have any comments that you might want people to know? Maybe something to refer to?
I don't want the parents to get nervous before the child gets seen and diagnosed. That affects everything. And I want them, please, to ask questions.
Yes.
They cannot shake their head. Yes. They have to know everything. And don't be shy asking the doctors. You can ask God for something. God, you don't ask doctor. They have asked doctors for explanation with no fear. Doctors are human beings. They are here to serve you. Don't ever be shy of asking everything. No.
Yes.
We do need to hear that.
The whole point is we're trying to figure out what's wrong with someone, and
getting to the bottom of that.
Getting to the bottom of it and hitting the issue before anything else happens.
Yes. Yes. Well, thank you so much for your time.
You're welcome.
Exactly.
Thank you for having me.
Thank you so much for being here. And I guess a little tagline to kind of end this, and we've talked about it before on previous episodes, but early detection is key to figuring out diseases and conditions. Education is also a very, very crucial part in furthering the knowledge of not just the parents, but children and the world out there. So like how we like to say here, stay safe, stay informed, stay educated. Thank you so much, Dr. Amer, for joining us on this episode. Don't forget to follow us on all of our social media platforms at CCPH Texas for all things public health and more. I've been your host, Javier,
And Andrea Gomez.
and we'll see you in the next one.
Bye.
Bye-bye.
You made me sweat, guys.
You did amazing.
Yeah, really. What do you think I survived for 27 years? It took me out.